I would like to thank the ICS for the opportunity to present today. My name is Yasmin and I'm Principal Clinical Scientist at University College London Hospital in the UK. Our study investigated the clinician factors affecting exposure to radiation during video urodynamics. Video urodynamics enable more precise delineation of site and cause of bladder outlet obstruction and/or incontinence, as well as additional findings such as vesico-ureteric reflux, but this is at the expense of radiation exposure. We have assessed whether clinician-related factors affect the total radiation exposure time and the actual radiation dose during video urodynamics. The radiation exposure time is an operator-controlled component that affects total radiation dose. We retrospectively reviewed the radiation exposure time and radiation dose of all 986 consecutive patients that were undergoing video urodynamics to investigate refractory lower urinary tract symptoms at our centre between 2018 and 2019. 31% of patients were excluded owing to missing data, abandoned tests due to patient or equipment factors, and owing to additional tests carried out at the time of the video urodynamics that further exposed patients to radiation, such as the retrograde leak point pressure test. Clinical scientists and training urologists used a standardized female functional and restorative urology protocol when performing the urodynamics, whilst the other groups did not. Total radiation exposure time and total radiation dose were determined and correlated with specialty and grade of clinician performing the test. Non-parametric statistical analysis was applied with the statistical significance determined. The median radiation exposure time and median radiation dose was determined for each specialty and grade of clinician groups performing the video urodynamics across all patients that met the inclusion criteria, and the results are listed in this table. The rate of non-diagnostic video urodynamics was similar in all groups and was 20% overall, and there was no significant difference in patients' age, presenting lower urinary tract symptoms, and sex amongst the groups, with the exception of the gynecologists. Taking a closer look at the results reveals that the radiologists, gynecologists, and radiographers deliver over double the radiation exposure time and a much larger radiation dose compared with the urologists in training and the clinical scientists. Across all of the clinician groups, it was the consultant radiologist that delivered the highest radiation exposure time and radiation dose. A further sub-analysis of patients that underwent video urodynamics on the same fluoroscopy unit and same patient groups that were either on the uroradiology or urogynecology pathway revealed similar findings, with consultant radiologists and gynecologists delivering near double the radiation exposure times and over double the radiation dose compared to the clinical scientists that were seeing the same patient group. So overall, we established that the total radiation exposure time and hence radiation dose varied widely during video urodynamics, that clinical scientists and urologists in training have significantly lower radiation exposure times and radiation doses, whilst consultants, in particular radiology consultants, have significantly longer radiation exposure times for the same diagnostic yields. In conclusion, patients may benefit from adoption of the female functional and restorative urology video urodynamics protocol to reduce total radiation exposure time and hence radiation dose. Thank you, and I'll be very happy to take any questions.